lift every voice and sing till earth and heaven ring, ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies.
Ladies and gentlemen, welcome to the NAACP Forum. We are Brockton's choice for civil rights news. I have with me today Dr. Squirm. Did I say it correctly?
Absolutely, thank you.
And Steve Bernard, the past president of the NAACP, here to talk about a healthcare crisis in the city of Brockton. And many will say extends all the way around Plymouth County, and that's prostate cancer. Dr. Squirm, first of all, give us a little bit about your background before we talk about this crisis.
Absolutely. I'm a physician specializing in imaging and other precision diagnostic tools and therapeutic tools for prostate cancer.
Wow. Is this all that you do?
It is all what I do at the moment. A couple of decades earlier, I led a development of precision diagnosis and treatment for breast cancer. And by now, breast cancer
That's fine.
Breast cancer care is transformed, and we are very, very pleased that in Massachusetts we have no disparities between black and white women.
No disparities at all?
No.
How's
no
that data looked
disparities
at,
in
though?
mortality.
Really?
For the last several years, we've noticed there have been no disparities in mortality between black and white women. It means that black women have the same probability of dying of breast cancer as white women. With prostate cancer, on the other hand, black men in Massachusetts are twice as likely to die of prostate cancer as Caucasian men. Twice
as likely to die of prostate cancer in comparisons to white males. That brings the NAACP into this. Steve, you got on this a couple of years ago, brought Dr. Squirm in. Why the involvement of the NAACP?
Well, it's more than a couple of years ago. It's back in 2015 at the annual New England Area Conference meeting that we had the opportunity of listening to Dr. Stern speak. And when we found out the information that she was sharing with us, that black men are 2.5 times likely to die from prostate cancer, we immediately, and that the incidence of prostate cancer in Plymouth County and Brockton was among the highest in the state. We needed to have Dr. Stern come to Brockton and share the emergency of this crisis with the community. Leona Martin and Janet Trask, who are the chairpersons of our health committee, were at that convention also. And they are now leading the charge of presenting prostate cancer awareness days in the city of Brockton. Since 2015, we've had a half dozen presentations, of which Dr. Stern has presented, and other doctors and medical professionals. And we're very pleased to report that the incidence of prostate cancer in Brockton and Plymouth County has reduced, and Dr. Stern will tell you more about that.
Well, before we get to Dr. Stern on the clinical piece, but I guess the question that many of us ask, I'm going to ask as a man, how did you get men to come out to discuss prostate cancer, or quite frankly, to discuss their prostate at all? We all know about those digital exams that we don't want. So I mean, how were you?
How were we successful?
Yes.
Well, it's such a dominant, such a dominant and large number of people in Brockton are suffering from prostate cancer. That surprisingly, although you say, gee whiz, it's so personal, that when you speak to your brothers and sisters, your brothers that are 40 years of age or older, African American or Hispanic descent, or have had a prostate cancer with someone else in their family, that it becomes a common topic. Oh yeah, I'm having those problems. Oh yeah, my brother or my uncle or my father
Having those problems.
have had those problems.
Right.
So it's a matter of communication. So when I go to the YMCA and I'm working out, and we are in the locker room and we talk about, as men do, about private things.
In the barbershop as well.
Or in the barbershop.
Yep.
You would just be surprised how these personal issues come out. And yes, as a result of finding out just how common it was, it made it easier for us to put on these events and have a good number of people show up.
So, Dr. Stern, the data suggests that there is a diagnosis of maybe 3 million Americans a year. 3 million, I don't know if that's 3 million Americans a year. Of those numbers, how many of them are African American, you believe, that are actually being tested? Because we've also heard horror stories that black men aren't being tested.
Absolutely correct. I would like to start by recalling our first event.
Yes, I remember.
In January 2016, first public event.
Yes,
we had a private event before that, but in our first public event, it was in connection with MLK breakfast in January 2016, and I asked people to raise hands if they had prostate cancer, if they had friends who had prostate cancer, or if they had family members who had prostate cancer. And I would never forget that just about every hand was up in the air.
Definitely there was familiarity with the disease.
Yes, because people just saw someone, someone close to them had this disease. And it's not really surprising because at that time, 1 in 5 African American men had cancer. Prostate cancer. Right now it is 1 in 6 African American
so the numbers
men
going
who
up.
had. Actually, it went a little down.
Okay. I'm sorry.
But if we look to address your question directly, however, regarding how many African American men get tested, it is roughly about between 30 and 35% of men who should be tested in African American community.
Wait a minute, Dr. Stern.
Actually are tested.
Define, you said should. Define should. Why should they?
That's great. Thank you so much for that question. Because African American men are more likely to get prostate cancer, about 60% more likely to get prostate cancer, and about nationwide, and about 2.5 times more likely to die. In Massachusetts, as I mentioned, black men are about 2.5 times, two times are more likely to die of prostate cancer compared to Caucasian men.
You said that we are more likely, when we say we, African American men, which I am one, when you say we're more likely to get it, may I ask the magic question, why are we more likely to get it?
That's a great question that we do not necessarily have definitive answers for, but we do believe it has genetic predisposition.
Oh.
And what we see in African American men, not only they are more likely to get prostate cancer, not only they are much more likely to die of prostate cancer, but they also get prostate cancer at younger age, in their 40s, sometimes in their 30s.
Wait a minute, Dr. Swarm. Now, I've gone to the physician. I've looked at the chart on the wall. It says 50 and up. You just dropped that 50 down to 40 and a bit younger.
Absolutely.
Where are you getting that data from?
Absolutely. If you, there was the largest study of its kind several years ago that actually demonstrated, it was done by a number of leading hospitals in this country, and they demonstrated unequivocally that African American men have are stricken with prostate cancer at earlier ages, 30s and 40s,
Okay.
particularly 40s, and are more likely to have much more aggressive disease.
But Dr. Shoreham, I need to talk to you like we're sitting in my living room.
Of course.
So when you go into, if I go into, no knock at my PCP, I go into my PCP's office, I don't see what you're saying. I see a chart that says males 50. I see nothing with respect to African American men or men of African descent with respect to this disease. What's going on in your field? I don't mean to put you on the spot, but
No.
I gotta ask.
Actually, I love the question. Because I love the question, Tony, because if we did not have discrepancy between the data seen by experts and the knowledge of PCPs, we would not have a need for our campaign. There is no separation. There is no current separation in how you approach high-risk men, men with high risk for
Why
prostate
is
cancer
that? Right.
vis-a-vis average risk. And that's the goal of our campaign. And the focus of our campaign is high-risk men, to make sure that men with African heritage, including African American men, including Portuguese men, including Hispanic men, men age 50 and older of any race or ethnicity,
Period.
men
Right.
of any race and ethnicity who have family history. These are high-risk categories, and these men need to know that they are, because they go to physician's office and
Right.
see exactly what you described. And their testing should be started at the age of 40, according to the consensus of the world leading experts.
Really?
Yes,
So the consensus,
African men with African heritage should have their testing started at the age of 40.
So let me just, because I have some very important questions about the clinical piece, so let me make sure that I understand this. If I am of Latinx descent, if I am Puerto Rican, Dominican, well, Dominicans they're pretty African anyway because of slavery, but if I'm a Puerto Rican, Dominican, et cetera, of African descent, I should be having a conversation with my medical provider
Starting at the age of 40.
Starting at the age of 40.
Starting at the age of 40. Wow. And you can see the sign in the office about starting at the age of 50.
Yes.
And because of the signs,
yes,
we are educating both physicians and patients. So if physician needs the information, patients would know, men would know to ask their doctor about testing and their higher risk for prostate cancer.
How do you, tell us a little bit about the diagnostics, or how do you know? What are they going to do to me in order to figure out if I have prostate cancer? What are the symptoms?
Actually, we hope very much that men will be screened, particularly high-risk men, will be screened long before symptoms occur. Because when symptoms occur, more frequently than not, it means that cancer has grown, and it may be too late to have curative intervention. So we are actually administering simple blood test, which is called PSA, and this is for men who have no symptoms whatsoever, healthy men, if they are at high risk starting at the age of 40. And this blood test can show much more accurately if this particular man, depending on testing result, is at higher risk of prostate cancer.
So the PSA, yes. I know that when I get my lab work, I have like this chart that says if I'm at 1.0, et cetera. But then I Google it. Google has something different, and you may go to another search engine. They all have, it seems like even WebMD has a different one than what my PCP has in my Health, my Health Connect. What is the right number that one should be concerned when you look at that range?
Yeah, I think that there is, over the last 7 years, there has been essentially particularly practically a revolution
Yep.
in the way PSA testing is administered. Now, if we look before that, since about early 90s, every man had a chance to have PSA screening, and as the result of it, mortality of prostate cancer went down by 50%.
So, Dr. Sherman, what changed then?
Okay? However, it came, so countless lives were saved. However, it came at a price of a lot of unnecessary biopsies and treatment.
Oh.
Because we did not have accurate diagnostic tools.
Right.
PSA blood test is a cheap test that can be administered to any healthy man starting at the age of 40.
Okay.
And this can basically show whether or not this specific man, irrespective of race or other risk factors,
Okay.
is at risk. And the best information we have today, after 7 years of transformative approach to PSA screening, that decreased unnecessary biopsy by close to half, is that we need to look, exactly what you mentioned, we need to look, does this young man at the age of 40, is his PSA less than 1? If it is, his probability of getting aggressive lethal prostate cancer is extremely low.
Gotcha.
If it climbs up to, let's say, 1.5, 1.6, we know that this man's probability of developing aggressive prostate cancer within 10 to 30 years is much, much higher. When men reach PSA 3, we know this men need to be evaluated very carefully with precision diagnostic tools we have today and that have been developed and implemented clinically over the last 7 years.
Could you do us a favor, because a lot of people are not, clearly our audience are not clinicians. What is precision diagnostics?
Yeah,
Wow.
Great question. Thank you so much. As any physician, I tend to
That's okay.
I tend to do this kind of speak.
Because people are going to be like emailing. What
This
is
kind of
precision?
speak. Yes, yeah. So if we look at screening, it is PSA test is administered for any man without any symptoms. Definitely important to do for high-risk men. Now, after PSA testing is done, and we can gradate risk, this can show us. Depending on PSA level, as I mentioned, is to what extent man is at risk of prostate cancer. Then we can decide if man PSA is less than 1, okay, then he can continue screening program every 2 or 4 years.
Every 2 or 4 years.
Every 2 or 4 years.
Okay.
If man's PSA level is between 1 and, let's say, less than 3, we should be doing testing every year. If men's PSA is climbing up to 3, that's where we need to do very careful diagnostic testing. And this can be blood tests, which have molecular markers that show biological probability of aggressive prostate cancer, or this can be imaging like ultrasound or MRI. So this precision molecular blood test, urine test, or imaging, that's what we call precision diagnostic tools.
Your recommendation as a physician, though, so if it gets to the point where I'm at 3, should I still be seeing my PCP, or am I being referred out? Because I know you're a big advocate of referring to an actual specialist. What's your opinion?
Absolutely. Men need to know, and it is one of the goals of our campaign to actually empower men with knowledge the way we empower women with knowledge about breast cancer, for them to know when their PSA climbs to 3, they need to ask for a referral to an expert. It can be urologist or it can be radiation oncologist, but it has to be someone specializing in prostate cancer.
Doctor, can you tell us what is benign prostatic hyperplasia?
Benign prostatic hyperplasia, it's actually benign enlargement of the prostate, and this is observed in almost 95%, if not 100% of men reaching the age of 50.
Okay, so when we see, because this is what many people that I spoke to were telling me, when they see this on TV, they're thinking that they have cancer because their prostate is
No.
enlarged and they're urinating all the time. And I wanted you to kind of dispel some of that
Absolutely.
myth. Yeah.
Glad to. That's why it calls benign prostatic hyperplasia.
Tell us what
There can
benign
be-
means, doctor. That's a big word. What is benign?
Benign means non-cancer.
Non-cancer. Okay.
Okay, and there are other non-cancerous conditions, such as, for example, infection or inflammation of the prostate that can cause PSA testing to go up. And that's why PSA testing alone cannot say if it is
that's
benign, non-cancerous condition or if it is cancer. That's why we need precise molecular diagnostics, precise imaging to determine whether or not what is going on and whether or not this man actually should have biopsy. And even conservatively estimated, this clinical administration of this precise blood and urinary test or imaging, such as MRI, there was a decrease of unnecessary biopsy by at least 50%.
50%. So Dr. Sherm is the executive director of Admitech. Steve, can I have that right there, your brochure right there? The Admitech Foundation. Award-winning research and advocacy is saving lives. So we want you to tell us a little bit about this big March 26th at the State House? What's happening on the
Thank you so much for asking.
The Prostate Cancer Awareness Day?
Thank you so much for asking. Admitech is undertaking a campaign
Yes.
in Massachusetts in order to create a Massachusetts model of national and global leadership
Wow.
in recognizing prostate cancer
Yes.
as a public health priority, as a central issue in men's health, and a leading health disparity. And the centerpiece of that campaign is Prostate Cancer Awareness Day
Yes.
at the State House that started, God help me, in 2019. We will have 12th annual Prostate Cancer Awareness Day.
Congratulations.
Thank you so much. As the result of this prostate cancer awareness event at the State House and broad-based campaign that we instituted with legislative offices, with governor's office, etc., we right now, prostate cancer right now is recognized
Right.
by Massachusetts legislature and in Massachusetts in general as a public health priority
I was at the
and a
state.
leading disparity.
I was at the State House not too long ago. I'm not going to
Yeah.
mention names. I have friends up there, and you were about to have a meeting with someone, and they were like, They was like, Bishop, I'm not going to be late for this meeting with Dr. Sir. And quite frankly, it wasn't even a rep that I knew, but that is your reputation in terms of your advocacy to help Black men, all men, but it'll help Black men save lives around prostate cancer.
Yeah.
So let me just ask you. Are you getting, what's the...
Can I please do something that is not done during
I know.
TV interview and interrupt you?
Go ahead.
I appreciate your kind words, but what happened was not done only by me.
Okay.
And it is really important for me to say that.
Right.
This is done in collaboration with
many
Admitech
people.
Foundation. We put together Prostate Cancer Action Council. It
Yes.
includes New England Area Conference of NAACP and its branches like Brockton branch. It includes Center for Elimination of Disparities located in Suffolk County.
I see that.
It includes Community Health Awareness Network in Worcester. It includes Men of Color Health Awareness. It includes organizations that I apologize if American Cancer Society New England chapter. It includes more organizations that I can mention. We also organized local clinical
Yes.
and academic leaders.
I see that.
Independent Blue Ribbon expert panel so that we will speak with one voice. We develop consensus and recommendations and what are the best clinical practices in screening, diagnosis, and treatment, and then translate it, if you will, in culturally appropriate language for everyone
Wow.
in Massachusetts.
So, Doc, we can't leave without talking about cure rates. Tell us about cures.
This is very simple. If prostate cancer is diagnosed early, every man is alive in 5 years. It is curable disease. If prostate cancer is diagnosed at late stages, when there is metastatic spread to distant parts of the body, such as bones, etc.,
Yes.
the survival rate, or if you look at 100 people,
Yes.
okay, 100 people diagnosed with extensive prostate cancer, only 28 of them will be alive in 5 years. So this is a very simple story to tell.
Early diagnosis.
Screening
Yeah.
as the access to early detection saves lives. What I want to mention is actually on January 27, there was a very exciting study that came out of Veteran Administration's healthcare system. And they looked at over 60,000 African American prostate cancer survivors, veterans, and over 40,000 Caucasian veterans, survivors of prostate cancer. They found no difference in mortality
Really?
between black and white men. With equal access to care, there were equal outcomes. In Massachusetts, we have universal health care access. There is no reason for Massachusetts, for black men to die at the rate twice as high as Caucasian men. The goal of our campaign to educate physicians and educate patients so that we will have the same thing that was accomplished by the VA system and the same thing we've accomplished in breast cancer. No disparities.
Goal, Steve, is to build a national model from the work that's being done in the Commonwealth of Massachusetts around prostate cancer. Do you have anything to add to what Dr. Schremer is saying?
Only to say that how fortunate we are to have partnered with AdmiTech and Dr. Faina Stern. What a blessing.
Yeah, it's been a blessing, absolutely. Listen, you all have been great. We appreciate you coming on the NAACP Forum. We want to tell the citizens that will be listening to this, don't forget about Prostate Cancer Awareness Day. The 12th anniversary is going to be held in Great Hall at the State House, March 26th, between the hours of 10 a.m. and 2 p.m. My name is Bishop Tony Branch. This has been the NAACP Forum. We remain Brockton's choice for civil rights news.
Thank you so much. Thank you.
Lift every voice.